name's Tim, I'll be a nurse. So I'm going to start off, and it's going to seem odd, I'm just going to stare at you. Okay? But I'm just going to see that, I'm looking to see that everything looks normal to me. Okay? So at this point, if it was a real patient, I would just stare at him. For you guys, because I'm grading you, I'm going to articulate what I'm staring at. Does that make sense? So Tim, because I will be standing right here, hello videos, I'll be right here at my table, I'll bring my peanuts, my popcorn, my pop, because it's like a video show for me. Okay, and I sit there and relax. I'm serious, I do though. Okay, I'm staring at his head. I think that Anthony's head is normal size for his body. It's round. It's normal cephalic. Okay, I don't think it's enlarged or small or anything like that. His ears are placed properly on his eyes, on both sides. Okay, I don't notice. It's very easy on Anthony. But do you mind if I touch your head, your body as I go through the assessment? Okay. So I don't notice any alopecia. Okay, areas of hair loss. I see that his hair is equally distributed. It's hard for me because of his hairstyle for me to determine if it's pliable or not. But I imagine by looking at it that would be. Okay. I don't see any lice, anything that looks abnormal at all. Okay. So any bumps, any tenderness, anything like that. Okay. So head looks good. His ears are in the right line. Anthony, you're okay to hear me? Okay.
Yes.
Yeah. And he's responding communication-wise to me. Since it's a head to toe, I don't need to do the whisper test. I can assume that cranial nerve 8, the vestibular apparatus, is intact here. Okay. I don't notice any excessive cerumen by looking at his ears. I don't notice any drainage, anything of that sort. Okay. His eyes, you see his eyes. His sclera is white. It appears that his cornea is, I see it, you know, the reflection of light on it, so it looks good to me. Okay. At this point, I'm going to dim the lights real quick. I'm going to go ahead and do my 6 fields of gaze.
It's not plugged in.
I don't think so.
You unplugged it.
I did.
Excuse me. My assistant must have unplugged it. I apologize. So, the lights are dim. I'm going to do perla. I'm going to do what we call consensual constriction rate. Staring at his left eye. Now I'm staring at his right eye. It's very hard for me to do this on Anthony because he has very dark brown eyes. So, perla, the PE, pupils equal round relative to light, and now I have to do a combination. Anthony, can you stare at this object? And then I want you to stare through it at whatever's behind it. Now stare at the object again. Don't, not up above, just pick this point right here, stare through that point. So look at that point, now stare through that point. Now look at that point, now stare through that point. I notice that he's accommodating, his eyes are doing the buggy thing, right? And now I want you to hold this as it comes in. And as it comes in, I notice that your pupils are constricting, and you're able to focus on that. I cause strabismus. Okay. I'm also going to do the 6 fields of gaze. Right. So, roll to the left, roll to the right. Nice and smooth and controlled, guys. Don't do this. Okay. I know you guys get nervous, but go slow. And on extreme lateral movement, Tim, talking in third person, right? Tim over there, I might see some beats of nystagmus, beating of the eye. That's normal, as the muscles which are being strained are not normally strained that way. Okay, as long as that goes away, not a concern. I basically assess cranial nerves 3, 4, and 6. Okay, so looking at his nose, I don't see any discharge. They appear patent to me. Okay, I don't notice any deviated septum. I don't notice any polyps. His nose looks good. Okay.
It's okay to use that instead of that for that?
Yeah, I mean, I'm not actually going up into it. I'm just,
Okay.
right, if I was doing a focus assessment, I'd be up in there. But you're not complaining of any breathing problems, any nostril problems. I'm just going to take a gross assessment. Okay, that's what a head to toe is. It's just it's not very fine assessment. It's just looking for abnormality. That's all I'm doing. Okay, let's move on to your lips. I notice you don't have any circummolar sinus. Again, in reality, am I saying any of this to him? No. I mean, I could tell him what I'm doing. It's not going to hurt if he asked. But I'm just doing this. But you guys have to articulate because I need to know what's going on in your brains. Okay, that's my job. So go ahead, open up your mouth and say ah. Okay, I notice that your uvula and your soft palate raise it even like the. Okay, you seem to have good hygiene, no cavities. I don't even notice any fillings. Do you have any fillings? Just one, maybe?
1 or 2.
Yeah, okay. Unlike me, I have like 12 of them. Okay, I didn't brush my teeth with this. Okay, so that all looks good. I don't notice any leukoplakia, any lesion in his mouth. His mucous membranes are pink. They're moist. Okay, they appear appropriate for him. All right. So now I'm done with my pen light. Okay, move down to his neck. I don't normally, when I do my head to toe, okay, on my patients, I don't do a lymph node assessment. Part of the HEENT. So I'm not going to do a lymph node assessment here. It's not on your head to toe sheet, is it? Okay, so I'm not going to do it. Okay, I don't normally do a thyroid assessment on my head to toes because this is the head to toe you do on your patient at the bedside, right? This is not the intake interview. This is not the extensive initial assessment. Okay, this is assessment just checking baseline.